The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. And Dr. David Schwietert practices in Rapid City, South Dakota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
I'm Dr. David Schwietert.
And I'm Dr. Richard Jensen.
Wonderful to have you with us in this dimension of House Call. As the screen shows you, contributing factors of osteoporosis. So we've been doing a series of osteoporosis because we receive so many letters from people asking us to talk about osteoporosis, about calcium, about the causes of osteoporosis, the cures, letters asking, well, my mother had osteoporosis, does that mean I'm going to have it? Or I look like my mother and I'm starting to get a little humped like she is, does that mean I'm going to have osteoporosis? Questions, I go to a chiropractor who doesn't x-ray me, and I have a family history of osteoporosis, is that dangerous? You know, all kinds of questions. What are bone density tests and things of that nature? So we're going to take a real good look at osteoporosis today, and we're going to begin with a definition of osteoporosis and osteopenia, because many of the letters ask us, what is the difference between osteopenia and osteoporosis? So we'll bring that up now and we'll look at that. It's kind of an interesting dimension of that. Osteopenia really is telling us that it's the early stages or a precursor of osteoporosis. Bones are in the earlier stages of beginning to lose their density. And so when a bone density test is done, if it's normal, it's normal. If it's just beginning to early stages of osteoporosis, then it'll be called osteopenia. But once it goes from osteopenia to a greater loss of bone density, then it's referred to as osteoporosis, wherein the bones become porous, kind of sponge-like. They have holes in them. They become weakened. And of course, they predispose people not only to bone fractures, but other health problems. Because many of the chronic back problems and joint problems, problems being diagnosed as arthritis or fibromyalgia, are really, in fact, underlying causes are osteopenia or osteoporosis. And so a lot of times, being doctors of chiropractic as we are, and people come to us with chronic back problems, many times those issues are related to osteopenia or osteoporosis. So what we're going to do now is bring up some interesting slides that will give you a better picture, a clearer picture of what osteoporosis looks like in the bones. So let's go to that now, and we'll go to Dr. David Schwietert.
What we have here is a model of a couple spinal segments. We have two vertebrae and a disc between them. Of course, think of the disc as kind of like a cushion that kind of like a shock absorber, so to speak. And then, of course, if you have color TV, you can see the yellow in there, and those are the nerves and nerve roots and plexuses that come out of the spine. That one that we're drawing up on top comes right down the back of the spinal canal, and then the root goes out on the side. And so we have different levels of spinal involvement, and those nerves, that wiring, as we like to think of it, goes to different areas. It controls motor, controls muscles, and it also has sensory fibers in there. And of course, when we do our examinations, and that's why exams are so important, is it helps the doctor become definitive on where to look for where the problem is. Various orthopedic and neurologic tests can point to these areas so that we can more specifically look at them in depth. And that's why x-rays are important as a base to help evaluate what's really going on in finding out what's happening. Now, as we look at that spine, you can see that there is nice approximation between the two bones. It's a little bit wider in the front than in the back, and that in the lumbar spine anyway, that's what we want to look for. And the bones should be nice and rectangular. Now let's
the disc should be pretty much of equal thickness in the size in the front, and where the nerve is passing off from the spinal cord, It's just not a nerve that passes out there. Arteries, veins, and lymphatics pass out from the spinal cord through those foramina. They're called intervertebral foramina. And that's where commonly pressure, interruption of the normal flow of blood supply, nerve supply, lymphatic supply is interrupted. And that's why it's so important that when you go to a doctor or chiropractic that they make not only front to back x-rays, we're going to look at some vertebrae in a minute or two here from the front to back, but also from the side or lateral projection. So what we're looking at now is a side or lateral projection. Those kind of lumps that are sticking out like thumbs on the back of the vertebra, those there where you see the arrow, those are called spinous processes. And those are anchoring places for muscles and ligaments and tendons, and also God put them there for levers for chiropractors to use as levers to manipulate, to adjust and treat those bones, to put them back in alignment when they are out of alignment. And when they are out of alignment, it is called a subluxation, which is a minor dislocation. Now, when one or more of those vertebrae becomes dislocated or subluxated, it not only adversely affects the vertebra above and the vertebra below, but it adversely affects the spinal cord and the flow of the nerves, the blood supply, and the lymphatics that pass out through those intervertebral foramina. Now, where that intervertebral foramina is there, where we have it circled in green and you see that yellow piece of like nerve coming out of there, that's called the lamina. And it's made up of the vertebra from above and below. And when chiropractic is no longer able to help realign those vertebrae and take the pressure off of the discs, the arteries, the nerves, the veins, and lymphatics, then the orthopedic surgeon will often go in and cut away, or actually chisel away, the bone, and that's called the laminectomy. Many times the back part of the disc also is protruded or herniated, and it's protruded back into those nerves, arteries, and veins, and they'll go in and trim up some of that disc as well. Now, very often that surgery is quite effective in relieving pain, but medical research shows very consistently that the majority of those surgeries, even though the ones that do improve after surgery, that if there has been arthritic spurs growing in that area, for example, or if the disc continues to weaken, that there will be a continuing problem. And therefore, that's why so many people who have laminectomies have repeated surgeries 2 or 3 times, 4 times after that. And so just because when you go and remove the bone in the disc, the body says, well, that's good, but it says there's supposed to be bone there. So the body then begins to grow bone back, and very often the old problem comes back. And of course, once there's been surgical intervention, scar tissue develops, and there are other complicating factors. Now, Dr. Sweeter, do you have any more to add to that?
Well, I do. I was thinking as you were talking that it's important that when we were talking about fusing or blocking these two vertebrae together when there is a laminectomy done, remember the spine is dynamic, and the reason that these cushions are flexible and moldable is because when we bend, when we move, those vertebrae are not static. They are not locked in one position. So what happens after surgery when the surgeons fuse these two bones together and basically make them so that they're immovable, what happens is that it puts stress on the discs above and below. And as Dr. Lala was saying here just a minute ago, what it does is it creates added stress, and those discs and vertebrae above and below are now susceptible to damage because they are hypermobile. In other words, they're being asked to do things and movement in a way that they weren't before. And what happens then is, let's say that you have a laminectomy at L4-5. That makes L2-3 above and L5-S1 below more susceptible to injury and damage. And of course, just like we've talked about in our previous shows, that a lot of this is systemic. This arthritis is not usually just in one area. It's in other areas too. It makes it just kind of like a stack of dominoes. One goes down, two go down, then the whole line goes down. It might not happen over a day or two or a week, but it does happen over months and years. And what it does is it impinges then upon the quality of life. We are not saying don't have surgery. We're not saying don't follow your medical doctor's advice. We're just saying that if it comes to that, know that there are consequences. There's things that are going to happen because it's an immutable natural law. God's design is natural law, will follow. And so what we're trying to do is show that there are preventive things that can be done, there are corrective things that can be done. There's a lot of good stuff that's out there that when implemented may not slow down the end result, or may not bring the end result and cancel it, but for sure what we've seen in our collective practices and in a conservative way of treating people is that it'll slow it down and improve the quality of life, and really isn't that what it's all about. It's about the quality of life that we want to have.
Wonderful. Let's take a look at another angle from the vertebra here. This is a cross-section of 3 vertebrae, and Dr. Jensen is going to take us and discuss that now, first from an anatomical perspective, and then from an osteoporosis perspective.
Okay, well, thank you, Dr. Lala. What we have here on the top here is a normal vertebrae, where, as you can see on the vertebral body, which is the front, where most of your weight passes through this, right on through the discs. What happens is on the outside here is we have what we call the cortical structure, and that's where most of the strength comes from. As you can see on this one, we're talking about this area of the vertebral body right here. So as we go back to this one, we can see that this cortical structure here is fairly thick on this normal vertebral body. And then on the inside, we have this area of bone that's called the trabecular area. And that is also quite full and quite dense in there.
Now, interestingly, with reference to people who are on Fosamax, and they think, well, boy, I'm on Fosamax, it's going to stop my osteoporosis. Research shows that Fosamax, when it is effective, will only keep or support that cortical layer that Dr. Jensen was talking about here for about 2 to 2.5 years. It does not go and produce more calcium within the matrix of the bone or the inside of the bone marrow. And so as good as Fosamax might be, there are a lot of contraindications of other health problems that the Fosamax can cause. So the Fosamax only works on that area where you see us highlighting it in green. It does not work on any of the osteoporosis on the inside of the bone. Correct, Dr. Jensen?
That's correct. And one thing is, if you're storing the Fosamax in here, if you're having problems with Fosamax and adverse reaction, you have to realize that as you start to age and you start to lose some of this mineralization in here, that Fosamax will start to be released back into the body as well. So if you have an adverse reaction, you're going to continue to have that years after you end taking it. Now, going into the disc in here, of course, this is a nice shaped disc starting out here, but now we come down to more of the osteopenia area. Osteopenia, we're losing some of this cortical thickness in here, and you can also see that this area inside, this trabecular area, is you're also losing density. So you're losing strength in both areas, the cortical structure and the trabecular structure. You can see it's happening throughout the entire bone from the changes back in here as well. So it's not just area specific, it's back here as well. But this is where the weight goes through this, so this is the most important area of that. You're starting to see some changes here where you're starting to get some calcium being deposited on the outside, or a change in the shape for the bone.
That's called spondylosis or arthritic spurs.
Right, right. And sometimes what happens is if there's inflammation in this area, it'll start to form across the tendon or the ligament, what have you, across the disc space and start to fuse discs together in order to keep this area from being hypermobile.
And very often the radiologist then refers to that as ankylosing spondylitis. And it's no different than if you had a finger that had some arthritis in it and you no longer could bend the finger. It's fused. All right, thank you.
Now, as you can see, this little bit of bending here, if this is the same kind of vertebrae as the one above, see how it's very straight across here. Now you're starting to have a little bit of a caving in, and this is due to microfractures that are occurring because of loss of strength. And you can see as it progresses to the osteoporotic point is that you've got this really caved in edge to the vertebrae here. And in some cases, complete vertebrae will collapse, forming almost a doorstop shape where it's a wedge, or sometimes it looks almost like a coin in there because it's collapsed just very thin. It's lost all of its weight supporting structure in there.
And so that osteoporosis then just isn't limited to what we would call the body of the vertebra, but to those spinous processes that we see in the back there.
It's also in here,
and
yes.
Other aspects of the vertebra. And now, I don't think any of you would allow an orthopedic surgeon or to do bone surgery on you without an examination, blood studies, and MRIs or CT scans. I don't think you'd allow anybody to do a heart surgery on you without the proper testing. And it shows that if you're going to someone who's doing massage therapy or heavy manipulation on your spine or doing rehab on your joints and you have osteoporosis, you are in a position where you are predisposed to not only injury but fracture, and therefore being treated, having your spine or any other joint treated without proper x-ray evaluation is really endangering your health. And many times you think, well, I go and I have these treatments and it helps me a little bit, I never get cured, and I keep going back and I keep going back, and nobody's really ever x-rayed you, or they haven't x-rayed you at least once a year or recently. You're really setting yourself up for some accumulative health problems later on. So you need to be very, very careful about that. You're really not saving any money by not having your spine x-rayed before it's treated. So let's take a look at the next slide now. It's quite interesting. What you see here, as Dr. Jensen has, this is, if we were to take a cross-section of the bone and highly magnify it now, of course what we're using here is a sponge, but Dr. Sweetert is going to discuss what it looks like on the inside now.
Well, thank you, Dr. Lala. As we look at this picture, you can see it'd be just like one of these ocean sponges. It has a matrix to it. It has holes that go in and out. And the reason, well, we think one of the reasons why God designed it this way is that it becomes a very strong structure with very little weight. And so all those little holes that go in between, in and out of the bone, make up this matrix. It makes it kind of like a skeleton of a super skyscraper. The way it's put together is it makes it very, very strong. So what we have here is the calcium and minerals that are laid down in a mat form that form the bone, that give it its strength and dynamics.
Now we have another view that Dr. Jensen is going to look at.
So after we start to lose some of that calcium in there, we start to form holes within this structure. And as you can see from before, where it was quite dense, from this, you start to have that opening in that trabecular structure like we were talking about before, where we have some large holes, but this is becoming much more porous throughout the whole structure. And so if we look at another example here, you have another example of bone. This, of course, is another sponge, but it's, again, it's much more dense. But as you start to lose bone and start to lose density within that area, we start to have more holes in here as well, such as these big gaping holes. And sometimes this is what actually occurs where there's no protein in there. This is what actually occurs inside of the surgical neck of the femur.
The thigh bone, the top of the thigh bone?
In the top of the thigh bone, where when people talk about having a spontaneous fracture in their hip, or the elderly when they say, hey, I fell down and broke my hip, many times it's not due to that. They broke their hip spontaneously fractured, which caused them to fall. And as you look, if there was no calcium in here, that's a hole. There's no protein in there or anything. It's just nothing to hold the weight in that weight-bearing bone, and so there we can have another fracture occurring in that place.
So it's basically kind of like a tinker toy skyscraper. You start taking out parts, and the other parts have to carry the weight, and eventually they can't do it anymore, and it collapses.
Absolutely, absolutely. So then, going on to this next.
What you see here is a vertebra, and we're looking at it from above down. And in the front, that's the body of the vertebra. And then to the sides, those go out into the lamina and the intervertebral foramina. And then at the rear, or the top of the screen, that's called the spinous process back there. That's that lever. And then to the sides, you see those two yellow projections. Those are like examples of the spinal nerves that pass out from the spinal cord. And with them, as we said here a few moments ago, and also pass arteries, nerves, veins, and lymphatics. Now that center hole that you see just behind the body of the vertebra, that is the spinal canal through which the spinal cord passes. So again, when a vertebra is out of alignment, that one there happens to be shifted slightly to the right as we look at it on the screen here. And we would call that a subluxation. That is posterior right inferior. So all chiropractic students, when they are taught methods and radiology, have to identify the location of the vertebra. Either it's in alignment or it's gone posterior, which about 80% of the vertebrae go backwards. That's why most chiropractors have you laying prone or tummy down when they're treating you, because the vertebrae have gone posterior. And then based on what the x-ray tells them, that spinous process is either shifted to the right or to the left, and the vertebra is either tilted inferior, down, or superior, up. So there's a real science to it, and there isn't anyone or any group of people who are more sophisticated in their education in the diagnosis of spinal problems as well as the natural treatment of them as doctors of chiropractic are. Now, in that body of the vertebra, that is where that sponge-like or the osteoporosis exists. There's holes in there. When it's osteopenia, they're quite small. When it's osteoporosis, they grow into larger holes, and that vertebra becomes weakened, predisposing the person not only to back problems, but also to spontaneous fractures. All right, we'll go on now and take another look here. This is looking at two vertebrae from the rear, and we see that yellow projection kind of sticking down at the bottom. That would represent the spinal cord. And then off to the sides, right there, that's the spinal cord. Off to the side, those are called facets. They're like shingles on the roof of a house, and the vertebrae glide on top of there. And when they become inflamed or irritated, often we call that facetitis. The side projections now, those are the transverse processes. The chiropractor often uses those as levers to adjust those vertebrae into proper alignment as well. So let's take a minute here and look at calcium for you. And Dr. Sweetert is going to begin. If you're interested in what we're talking about here, this is an excellent pamphlet that we can send you at no charge. That's all you have to do is call us, and we're happy to send you this pamphlet. And if you're going to leave, you don't need to talk to any of us. You can just leave us your telephone number and address so that we can get it in the mail to you. But it's osteoporosis, and it really discusses everything that we're talking about here on the program. So now Dr. Sweetert is going to discuss an x-ray here of some calcium, and then we're going to look at the different types of calcium next.
This is a really interesting x-ray, and we see it quite frequently actually in our practices. And what you're looking at is the lumbar spine. It's a side view. There's the hips on the right, the hip bone on the left, and then the spinal column L3, 4, 5 right there above, and then the sacrum's below. And what we're drawing green circles around are, well, we call them white jazz. No, I'm just kidding. Actually, those
They're artifacts, aren't they?
They're artifacts. And what they are is actually undigested calcium supplements that people have taken that are in the digestive tract that have been unbroken down, they've undissolved, and they will be excreted in that same form.
Interesting. Those were calcium carbonate-based crystals.
Okay, so where does calcium carbonate fit in? And one of the things we're going to look at are the different forms of calcium and their importance of how they're absorbed. Remember, just because you take calcium does not mean that it's going to be broken down and absorbed, because there's different forms of calcium within the body, and different people absorb different forms of calcium better than others. So let's start at the top. The best and most easily absorbed calcium for bone is microcrystalline hydroxyapatite, MCHC as we call it. It's 24% calcium. It's the best form of calcium. It's a complete bone food. It contains a variety of essential minerals and amino acids and protein for the matrix of human bone. It promotes increased bone density, arrests bone loss. So this is the one that if you've already got osteopenia and osteoporosis, this is the one you really need to be taking, because it stops that. It's scientifically shown to stop bone loss. And that's the one that you want. And also, it's the best form of calcium for people who absorb calcium poorly. Because remember, you see in the human body, calcium is metabolism and absorption and excretion are controlled by the kidneys and the parathyroid glands. And so it has to come from somewhere. It either has to come from our diet or from our supplements. And so as we said, different forms of calcium are absorbed differently. Now the next form of calcium, the next best form of calcium is calcium citrate. It's about 18% calcium. It's well absorbed. It reduces the risk of kidney stones. It's absorbed by those with poor digestion, but it is not a complete bone food, thus supplying insufficient calcium to the body. Dr. Lala.
And as you see there are other forms of calcium, and they are not as good a product. That's just the way it is. That's the way science makes it. And dolomite and bone meal being the least absorbable form, then calcium carbonate is another highly unabsorbable form of calcium. If your calcium gluconate should not be taken by people who are diabetics or have hypoglycemia or have a history, family history of diabetes or hypoglycemia. If you want some information on this different type of calcium, it's all you have to do is call us. The announcer will bring up the address and telephone number. And again, take good care of your body. Just don't take some advice, and base what you do, even the food supplements. If you take food supplements, base them on scientifically based testing, not on some anecdotal information or some advertising on television or in newspapers or in magazines or some celebrity that's getting paid. I mean, the week doesn't go by that some drug company who basically own all of these vitamin companies doesn't come by and offer us money to endorse their particular products, that we would go on television and on radio and endorse their products. And we're not going to sell our souls for that. Are you with me? That's not right. We could make money doing that, but we have to look at what Jesus would do, and we don't happen to think Jesus would do it that way. We really don't. So take good care of your body. Look to Jesus as your great physician, and you'll find him performing miracles in the natural and supernatural realm to the extent that you honor good and faithful stewardship.
The Fellowship of the Great Physician, through its School of Health and Healing, provides classes each Thursday evening. The primary focus of these classes is biblically based spiritual health and healing, with a brief teaching on physical health and healing. There is no charge or registration fee for these classes, but a free will offering is received. For further information on the School of Health and Healing, class time and location, or the topics discussed on today's program, contact us at the Fellowship of the Great Physician in care of Dr. Lala or Dr. Jensen at 200 Village Center Drive, Suite 100, North Oaks, Minnesota.